Wondering how to keep your endocrine system in check? Let's dive in. Welcome to Ask Endocrinologists. This is your go-to channel for all things related to endocrine disorders and healthy living. Whether you're dealing with diabetes, thyroid issues, bone health, infertility, or just interested in maintaining a balanced lifestyle, we've got you covered. Our mission? To empower you with expert advice, practical tips, and the latest research to help you understand and manage your endocrine health. Join our community of health enthusiasts and connect with others on the same journey. Don't forget to subscribe, follow us on social media, and hit the notification bell so you never miss an update. Let's take control of our health together, one video at a time. Welcome to Ask Endocrinologists. The more you know, the better you are.
Hello, and welcome to Ask Endocrinologists. It's so great to have you all with us today. I am Dr. Hope, and this is Dr. Grace, and we are here to answer all your questions related to your hormones and endocrinology.
Yes, we welcome you all. If this is your first time of joining us, we say welcome. This is the channel where we talk about our hormone and we talk about major things that you need to know in endocrinology. You know, so many people don't know what endocrinology department is and what specialty this is. So you are in the right place. We're going to talk to you more about hormones that control your blood sugar, thyroid, the bone, you know, infertility, and even obesity, So many things we talk about in this channel. So if you are here with us, I want you to kindly share this link to your friends and families and tell them to come on board. It's a short minute for us to talk. We're not going to be here for long. In 20 minutes, we'll be out. So we just want to make sure that, you here with us to hear what we have to say, a few questions and all those. And if you have any question, put your question in the chat and we are going to answer your question live and direct.
All right. So I just wanted to catch you up on my marathon progress. So as you know, we've been talking about health, right? We were talking about being healthy and we talked about the tips on staying healthy. And one of them is including exercise in your regimen. So I am training for a marathon. I would like to do the half marathon coming up this May. And I've been on a program with Peloton. I've been doing running 4 times a week. And also I joined New York Roadrunners. So I wanted to say that I'm so happy that I was able to do a 5K run. And then today I was able to do a 10K run. So if I can do it, you can do it as well. All right.
That's beautiful, Dr. Hope. I am impressed by your steps, that you pushing hard to make sure you don't relent, you go from 5 to 10,000 and before you know you're running a full marathon, Yes, exercise is very important. Why do we talk about it all the time, It's an important, I would say, an important way to build your body, to keep yourself active and to also keep going, So many times we are carried away with daily activities. And when we get back home, we are very tired. And all we want to do is just sleep, eat, and relax. But we should not forget that, even when you go out for your walk or to school or wherever you find yourself, you count your steps, Yeah. And not just counting steps. If you can run. If you can skip. Whatever you have to do, you have to move,
Yeah. If you can swim, if you like swimming, that's an activity, walking. But the recommended amount of exercise that's generally needed is at least 30 minutes more than 5 days a week. So that's what we recommend, of just being active. It could be walking, swimming, running, any type jumping, just any type of aerobic exercise, but also you have to incorporate strength exercises into your routine as well. So weightlifting, push-ups, sit-ups, strengthening exercises that strengthen and tone your muscles.
Yes, absolutely. I want to dive into vitamin D deficiency. I notice many people are deficient of that vitamin D deficiency, and they are not aware.
Yeah,
Maybe you've been sleeping and you get tired after waking up despite adequate sleep, and you feel like, okay, I thought I slept well, but why am I still tired? Or probably you walk in and but before the end of the day your energy is gone and you don't know what is going on.
right,
Most of us work indoors and you don't have that adequate exposure to vitamin D, and that makes a lot of people deficient for vitamin D. Vitamin D is very, very important in our body. It keeps our bones strong, and for children or for people who are still growing, it helps them in growth as well. So, vitamin D, we always recommend that at least even if you don't know whether you have vitamin D deficiency or not, try number one, try to check it to ask your doctor to check your level of vitamin D. And secondly, it's okay to take vitamin D supplement over the counter, you know, and get exposed into the sun or just be in the sun between 10 a.m. and 2 p.m. of the day when the weather is warm. I know we are in winter season, it's very cold. And maybe you are outside the country, you are outside the place where it's cold, you are in a warm zone. It's also good to just stay in the heat around 10 a.m. to 2 p.m. And according to the research, it says you have to be in there like 10, 15 minutes, or when you feel the heat on your system, your skin, but not burnt, but you feel the heat.
that's right. Yep, and nutritional sources of vitamin D include milk, uh, even some so other cheese, dairy products, yogurt, they have vitamin D as well. So we recommend the best way to replenish your vitamin D is from the diet. However, if you're unable to have a consistent intake of food with vitamin D, then you can use vitamin D supplements, at least 1,000 international units of vitamin D. So definitely should be taken every day to replenish your vitamin D because, as Dr. Gray said, many of us have vitamin D deficiency.
Yeah, yeah.
Yeah.
Yeah, so there's a question in the chat. Thank you for asking. And this is just a gentle reminder as well for those of you just joining us to drop your question in the chat, in the live chat. And we're going to read it out and answer your question in a timely manner. So someone just asked question and say, can someone have too much vitamin D in their body? Or what is called vitamin D intoxication? Yes, of course, you can have vitamin D intoxication, and we call it intoxication because you can get intoxicated with vitamin D. And what then happens is that when your vitamin D level is too high, your calcium level also goes high, and you can have something called hypercalcemia. And it's actually one of the secondary causes of when your parathyroid hormone gets abnormal, and then we are looking for why is your calcium level elevated. Yeah, and that can happen. And you have those similar symptoms that people who have high level of calcium will have. You'll be urinating a lot, drinking a lot, pain in the body, pain in the joints. And, sometimes they get confused or like they don't even know what is going on. So, but I think at that level, it has to be very high before you can actually affect your mentation, which means your mental status.
Yeah. And how do people get vitamin D intoxication? I think you don't really get it from diet, the regular diet, or, sun exposure. The people that do get vitamin D intoxication is from taking too many supplements that contain vitamin D. So it's usually from high levels of vitamin D in supplements or in usually the normal vitamins, like the one a day vitamins, or vitamins that are multivitamins, usually have a normal amount of vitamin D. But if we take too much of that or very concentrated doses of vitamin D, that can lead to vitamin D intoxication. So yes, it definitely can happen. Thank you for that question. That's a great question.
Yes, absolutely a great question. Yeah, so vitamin D, don't, because you don't want to get intoxicated and then not take vitamin D, because it's very, very important that you have adequate nutrient of vitamin D. I know during the COVID time, this is out of the study, it's out of the research study, but a lot of people in some other countries were taking vitamin D, and it helps their immune system to boost up and prevent the COVID worsening symptoms and the like. There is no research on that, but on a side note, that's what some people said they do, and it was helpful. So vitamin D on its own is very good. People who have multiple sclerosis, they tell them to take vitamin D because it's important in helping them, preventing them from going into relapsing. So vitamin D is a very important thing, and for us as well, because when we have a patient or we have people who have osteopenia, one of the things we also want to make sure, and what is osteopenia, by the way, is when your bone is weak, but it is not completely weak to the point that it can easily break. So it's like saying you have pre-diabetes. So when you have osteopenia, your bone is kindly weak, but you have to watch out. So when we have patients or people who are in that condition already, one of the way we optimize is muscle strengthening, take vitamin D with calcium to help. And so, like Dr. Hope has mentioned, take vitamin D 1000 daily, or your diary food containing vitamin D doesn't make you intoxicated. People who are taking the 50,000 units, or those big amount of units, and taking them for long can truly have intoxication.
Yeah. So your doctor can recommend 50,000 international units of vitamin D when you're deficient, but usually they recommend it once a week
Yeah.
for a few months, depending on how low your vitamin D level is. And sometimes I've seen it given just for a few days, maybe consecutively, but not for months and months at a time. So
Yeah.
definitely that can lead to intoxication. But I'm glad you mentioned that. So to prevent osteoporosis, to protect our bones, we all should be taking in a standard amount of vitamin D and calcium. So calcium is needed for bone growth and bone health. Calcium and vitamin D are both needed for bone health. So we should have at least 1,200 milligrams of calcium daily. Again, the best source is through the diet, dairy products, milk, eggs, cheese, yogurt. Those are good sources of calcium, and they should be in our daily diet. However, if you're unable to take it consistently in a diet, definitely vitamin supplements is another great source. So at least 1,200, 1,250 milligrams of calcium, and at least studies say at least a minimum of 800. I usually tell my patients to take at least 1,000 international units of vitamin D daily. So those together can help protect you from osteopenia, thinning of the bones, and osteoporosis, which is true worsening the medical form of diagnosed thin bones that can lead to increased risk of fractures, of bone fractures. So
Yeah.
that's why we protect our bones, so that if we fall or if we hit our bones, that we wouldn't get fractures easily.
Absolutely. Someone complimented and said, by the way, Dr. Hope and Dr. Grace, you both look amazing. Well, thank you very much. I think Dr. Hope is doing a great job doing more exercise than I do.
And so are you. You're doing a great job too. So thank
Yeah.
you.
I really want to be more like doing more active, be more active. So when I talk to people and tell you do exercise, I'm also counted. And when Dr. Hope is telling everybody that do exercise, go for the marathon, take the bike on the road and ride, I'm included in that.
Yes. There's another question.
Yeah.
One is, what are the early signs of diabetes or thyroid disorder? So let's start off with diabetes. So what are the early signs of what are the early symptoms, signs and symptoms of diabetes? So, so some of the early symptoms of diabetes are increased thirst and increased urination. And why is that? Because the blood sugar level is high in the blood and the body tries to get rid of it by causing you to lose it in the urine. So you end up urinating a lot. And because of that increased urination, you're thirsty. So you want to drink a lot. And that leads your increased urination can be so much. Since our body is composed mostly of water, right? 66% of our body weight is water. So that can lead to significant weight loss. So when we lose that water through the urine, it can be manifested in weight changes. So significant weight loss. So weight loss, not the healthy way. That's not the healthy way to lose weight. Weight loss, fatigue, feeling tired, feeling thirsty, and also blurry vision. And that's due to increased blood sugar, in the behind the eye as well. That can lead to blurred vision. So those are some of the early signs of diabetes: increased thirst, increased urination, weight loss, fatigue, and blurred vision.
Yeah.
Anything you want to add to that?
Just to add to that is that, sometimes because type 2 is different from type 1, which means that the different classes of diabetes, So some people have this, they're already diabetic, but because they are not checking, they are not aware that they have diabetes. And which means that you could be having the frequent thirst and you just attribute it, oh, the weather is so hot, so I'm drinking so much. Or if you're going back to the bathroom a lot and you're like, oh, I'm using the bathroom more because I'm drinking more water. And you're tired and like, oh, it's because I've been stressed, I've been tired, I've not been sleeping well. And you just give reasons and different reasons, to why those symptoms doesn't fit in for your diabetes. And that is why oftentimes when diabetic patients with type 2 are found, we have to like start screening them for every other organ that the diabetes must have been trying to affect, because a lot of people can still live their life even with those symptoms and they are not considering it that it could be diabetes. So that's why we encourage to please go for regular checkup every year. Please see your doctor just for them to do some blood work and just for you to listen to your heart and all those. They do blood work and then they confirm that you have pre-diabetes, watch out, or you already confirmed diabetes.
Thank you, Dr. Grace. The second half of that question is about early signs of thyroid disorders. So you can have different types of thyroid disorders. Let's first talk about the overactive thyroid or hyperthyroidism, also known, the most common form is called Graves' disease. And but also you can have hyperthyroidism from toxic nodules and other causes of hyperthyroidism, but those are the most common. So what are some of the symptoms of an overactive thyroid? So definitely weight loss. Weight loss is usually, I think, one of the most noticed symptoms of hyperthyroidism. And by the way, the thyroid is in the neck. It's a gland in the neck that's responsible for making thyroid hormone. Thyroid hormones have an effect in all the different organs in the body. So there are thyroid hormone receptors in the heart, in the muscle, in the brain, in the gut, in the intestine. So the effects of thyroid translate into many different organ systems. So again, weight loss is one of the first symptoms. Palpitations, your heart starts racing because thyroid hormone increases your metabolism. So you can feel palpitations and your heart rate can go up to even, over 100. And you can even develop an abnormal heart rhythm called atrial fibrillation. So feeling your heart beating fast, anxiety. Some patients with hyperthyroidism can notice, increased anxiety, just feeling nervous, weakness, just fatigue, hair loss. Those are some of the symptoms. For women, they can notice irregular menstrual period. So either it comes less often or more often, or just missing, several months at a time. So those are some of the symptoms of hyperthyroidism. Grace, you want to talk, Dr. Grace, about hypothyroidism? Maybe some of the symptoms of hypothyroidism?
Sure. So yeah, for the hypo, we also call it underactive thyroid. And just a reminder, we have some videos about this. If you can check our channel, we have talked in depth about thyroid, overactive thyroid, underactive thyroid, the nodules and all those stuff. So we encourage you to please check the videos in our channel, in this YouTube channel, and you can learn more about it. Yeah, but just for a brief, hypothyroid, which is underactive thyroid, we're talking about when everything, like your body is just slowing down, which means you're constipated because your gut is slowly processing the food and everything. You're sleeping too long, you're very tired, and your skin is dry. So everything is just on a slow pace, And when you sleep, you just want to keep sleeping. And then you're gaining weight. You try to lose the weight and the weight is just not going down. And then it just keep going and keep going. So these are common symptoms. There are many other symptoms that can happen, just like with the period. It can affect the period as well. It can cause depression. It can cause weight gain. So when you notice any of these symptoms, thyroid is something that when it gives you symptoms, it will show up in the blood work as well. So get your blood work done. And as a gentle reminder, with endocrinology and hormones, most of these things are identified or diagnosed by blood work, simple blood work, before we go into the imaging and all those things. But simple basic blood work can actually identify and tell you what the problem is. Yeah.
Okay, so someone has a question about the A1C of 6. So she said her A1C is 6, but she was told that it was okay since it's stable, I guess, consistent. And what do we think about that? So hemoglobin A1C of 6 is consistent with pre-diabetes. So that's not diabetes, but it is putting you at risk of developing diabetes. So diabetes itself is diagnosed when you have a hemoglobin A1C of 6.5 and above and higher. Prediabetes is defined as a hemoglobin A1C between 5.7 and 6.4. So if you have an A1C of 6, you are at risk for diabetes, but you don't have it. So that is the perfect time to make lifestyle interventions that can prevent you from becoming diabetes. It's nice that it's stable for the last 2 years, but you want to get out of the pre-diabetes range, right? So you want to push it to where you can go below the 5.7 mark. And what can you do? How can you do that? Lifestyle changes include weight loss. So that's number one, right? Because increased weight, even if you're not significantly overweight, even if you lose just 5 to 10% of your body weight, then that can bring you from the pre-diabetes range into the normal range, which is less than 5.7. Changing your diet, cutting down on the carbohydrates in the diet and eating more vegetables. So I usually tell my patients, I show them the plate from the American Diabetes Association. Half your plate should be vegetables, a quarter carbohydrates, and a quarter protein. So that carbohydrate, it's one, or if you use more than one carbohydrate, then you have to divide that quarter plate. You have to share it among all the carbohydrates. So that can include either rice or potatoes or pasta. or green bananas some people eat. So different carbohydrates should only take up a quarter of your plate. And then again, the other quarter is protein, and you can include fruit also in there in the diet. So so changing the diet and exercise, just staying healthy as we discussed with increased exercise. Aerobic exercise, at least 30 minutes greater than 5 days a week, to help maintain your metabolic activity. So, however, there are medications that can be taken in prediabetes, but the best way is lifestyle modification. But if you do take medications, metformin is the first line medication that can be used in prediabetes to help prevent you from becoming diabetic. But it's also used in diabetes. It's a medication that treats diabetes as well. All right.
Yeah. Yeah. So additionally, I just wanted to add that, if you have pre-diabetes 6.0 and it's been for quite a long time, as I said, for the last 2 years, one other thing I also want you to consider is to make sure you do not have any form of anemia, because there are some hemoglobinopathy, which, well, it's a big medical jargon word, but when you have a problem with your blood, which is when your blood level is not adequate, it can cause falsely elevated hemoglobin A1C. So if that is there, that also has to be treated. For instance, if you have iron deficiency anemia, if you control and treat your iron deficiency, your A1C can also improve. And this is just in addition to what Dr. Hope has mentioned, in addition to your diet, exercise, and medications, to also consider other things that could cause your A1C to be falsely elevated. Okay.
One other question. Should someone over 50 years old be concerned about any other complications as they age, for example, heart and kidney function? If you stay healthy, like as you get older, if you maintain a good diet and exercise, you don't have to develop poor heart and kidney function. But there are things that could put you at risk of developing those things. So just because we age is a factor in that it puts us at higher risk, but we don't necessarily have to develop those things. If there's a family history, we're at higher risk. If we're obese, as in addition to us to being obese or overweight and having a family history, as you age, the risk of developing complications are higher, but it's intermingled with those other risks, which include family history, obesity, our diet, lifestyle, exercise, and the risk of kidney disease and heart disease are higher in patients who have diabetes. But again, if the diabetes is controlled, it decreases your risk of developing those things.
Yeah. If you're joining us for the first time, I want you to please subscribe to our channel, then like, share with family and friends. This is a place where we just want to help everyone and to let us know that the more you know, the better you are. So, and you are here to ask a question. We are both experts in endocrinologists, and we are here to help out and help us live a better life in the community, help every one of us. Okay. Yeah. So on the personal note, my own advice, which I usually give my patient when they are at 50, is that, just try to avoid those things, because prevention is better than cure, just like Dr. Hope has mentioned. In addition, I'm just going to say that let's assume you know what it takes to be diabetic and what diabetic people usually prevent, which means they eat less carb, they eat more protein. So you can customize your plate in that fashion as you clock 50, and just tell yourself, okay, I'll be eating small portion meal, I'll be eating less carb, just so you can prevent, the risk of having diabetes, And if you someone who likes salty food, but eating a lot of chips, you want to reduce your salt intake so that that doesn't harm your blood pressure. You drink more water, you do exercise, you sleep well, you distress anything that stresses you. Look for things, what makes you, what are the things you do for fun? If your own is to spend time with family, create a day when it is all for family, whatever works for you, and just adjust your lifestyle. And you just need to make sure you do regular checkup. And also at age 50, there are a couple of screening things you should be doing, right?
I was going to say that. That's a good point. So
Yeah.
screening things for men and women is colonoscopy, right? It's
Yes.
even at age 45 now, you should have a
Mhm.
colonoscopy to screen for colon cancer. For women, you should have a mammogram. By age 50, you should have had a mammogram already, right? So every
Yes.
year you should have your mammograms, regular, consistent mammograms. As we get older, beyond 50, and if we're at increased risk of osteoporosis, then you'll have to do a bone density, especially if there's a family history of osteoporosis or a personal history of thin bones. But that's as you get older. Always do the pap smears. Men have the prostate evaluated. They're, to screen for prostate cancer, and just do your general screening tests with your primary care doctor. Make sure you have an annual health visit and health screen. So for blood tests to evaluate your CBC and your chemistry, just do general physical exams. So those should be done for everyone, but especially as you get older, over 50.
Yeah. Yeah. And lastly, just to buttress on that part, is to ensure that, you don't ignore the screening and you quit some very bad habits like smoking, alcohol, sleeping 3 hours a night per night. It's not good. You want to make sure you sleep good and you sleep well. You create quality time for yourself to sleep. Some people don't, they pride themselves in, oh, I'm very busy, I'm a very busy person. It's okay to be busy, but don't forget self-care, Self-care is very important.
And you should, as an adult, you should get at least 8 hours of sleep, right? At least
Yes,
8 hours.
yes.
That's our goal.
And I think we discussed this part last week.
Yeah, we did. Yeah.
Yeah. So please check on our video. We have a couple of interesting videos out there to learn from as well. So let's read the last question and call it a day, right? It
Yeah.
says, what test do you use to diagnose endocrine disorders? Yeah. So, well, endocrine disorders are many, and a lot of people are not even aware of these endocrine organs until there is a problem, and then they tell them, "Oh, this is one of your endocrine organs. You need to see an endocrinologist," and then the story begins. So most of the tests are through blood work, and like we said, we sit down, we listen to you, we hear you out, so we know which of the organs is having problems that we need to check. And we check to confirm what the problem is. And sometimes your primary care initiate the process already. So what I would advise is anytime you feel like you're having a problem with yourself, you don't really know what is going on, seek your primary care, which is your general practitioner, and let them evaluate you. They run some blood work. They know what blood work endocrine problem requires, and they do the blood work and send it to us if there's any abnormal problem or abnormal results in it. And we take it from there. We don't do only blood work. We can further evaluate you and say, okay, you might need a CAT scan, MRI, and DEXA scan, and all those stuff. And yeah, but we usually just start with listening to you, examining you, then doing the blood work. And if your primary care already initiated this process, it makes it easier and quicker for us to assess and diagnose you quickly.
All right. That sounds great. And we had a lot of really great questions tonight. Thank you so much for participating and for asking your questions, because the more you know, the better you are.
You are, yes. The better you are. So thank you all for joining. We will be doing this every alternate Saturday. Do I say every alternate Saturday? No, that's I take it back. We said we'll be doing it once a month, right? The other weekend will be for our recorded lectures, our recorded
That's right.
topic that we will present to you. But once a month we will. And please stay tuned, okay? Join this group, join this channel. It's a very healthy channel where we we are here to help,
Yes. Yeah.
and
Yeah.
not just you, friends, family, the whole world, Tell your people, everyone around you, share them the link, and let's see again in February.
Yeah.
If you think of any questions before then, you can always write it somewhere and keep the date, and we will let you know. Hopefully, we'll have a steady calendar
Yeah.
for this live presentation.
Yeah. Yep. All right. So thank you for joining us again. I think it may be February 22nd might be a great date, but we'll look out for us around that time, but let us know. We'll let
Oh,
you and please, if you subscribe to our channel, then you'll get the notification also when we're coming up.
yes, absolutely. Yeah. All right. Thank you, and have a pleasant weekend.